All right. Hello. It's Thursday, and we are actually in the office and not running around enough to do a show. So I know that we haven't been totally consistent with our shows, but that's because Dr. Galloway and I have been traveling. And so we actually have a really fun topic today that we came up with. But before that, as always, I'm going to have Dr. Galloway kind of share about our YouTube so that I can share this out.
Yes. So if you go to YouTube and go type in our business name, you can subscribe. And we're slowly getting more subscribers all the time. But this is kind of an easier way to send a show to somebody if you want, if they don't have, Instagram or something like that. If they don't have Facebook, you want to share it with them this way. Sometimes that's easier for them to view. You can see all our little thumbnail images of all the shows. And yeah, we haven't been here every week, but we try to be consistent as possible. So coming up with new topics.
Yeah, so I'm just finishing up our share. This topic today is going to be kind of nice because it's something that we definitely want you to share with people, because we're talking about having hearing loss with kids. So let me just remove that and get started here. Okay, so our topic today is basically, because we see a lot of kids or pediatrics, and anything from birth to all the way up to 18. And then I guess they're not considered a kid anymore after 18. So we see a lot of kids here, and we've had a lot of conversations with parents and their kids. And we thought that it would be really interesting to kind of review and share some of our experiences with even our babies and the parents and the families all the way up to age teenage years as well. And so Dr. Galloway and I have different experiences that we're going to kind of share and talk about some of the different ages as well. So, when we're talking about hearing loss with kids, it starts at birth, basically. And in hospitals, there's a possibility that the child or the baby has gotten screened for hearing before their discharge. They try at least once, maybe twice, but not more than 2 times before their discharge. And if they found a hearing loss, hopefully it's just because the vernix in the ear canal from birth, or maybe not being able to get a good seal or whatever it is. And then they pass when they come for another screening outside of the hospital. If they don't pass that screening, then they go through an auditory brain response test, or sometimes they do a full, what we call ASSR. We used to be able to do it, but we decided not to be able to do it. So we actually have those babies that need a full diagnostic go to Children's Hospital. Sometimes if they're older than 6 months, sometimes they have to be sedated to get all that information. But the nice thing about it is, through those tests, you can get multiple frequencies on each ear at the same time. So you can pretty much know where their hearing loss is, as well as if they need hearing aids. And you can fit hearing aids based on that test, which is super cool. So that's the diagnostic part of it. But the conversation behind it can be a little bit difficult at times. Most of the times, by the time the family comes back from the diagnostic testing, the parents kind of already know, and they're like, they're slowly kind of eased into the fact that their child might have, or their baby might have, a hearing loss. At this point, when we first diagnosed it at birth, sometimes we recommend genetic testing to make sure that there isn't anything else like a recessive gene or something that's being missed, so that the parents know for future pregnancies or births as well that there might be a hearing loss. So we usually do genetic testing recommendations, and then we follow up with the baby, and we can get the baby fit. It is super important. We've talked about this in previous different episodes, that it's super important to try to identify hearing loss and get the baby fit with hearing aids before 6 months of age to really reduce the speech delay or the language delay as well in the process. And that was research that was done here in Colorado through the University of Colorado with Dr. Christine Yoshinaga Itano. So that is,
I think her research too showed that as long as we can identify by 3 months and aid by 6 months, then the kids will match up with their age-matched peers as far as language skills.
Yeah.
So it's really important that we try to get that before that time period, so we don't set them up for, a language delay or something like that. The other thing I was going to say is about genetic testing. Sometimes there are syndromes that might not be identified yet that maybe a hearing loss can tip us off to do genetic testing, and then we find out that a kid has a syndrome and we need to be worrying about other areas or doing some other testing. So that's another thing too, that sometimes hearing loss, when a child is born with hearing loss, sometimes they can be born with some other developmental issues that we can be aware of by doing genetic testing.
Yeah. So those are kind of babies at birth. And then I'm going to have Dr. Galloway talk a little bit more of like easing into kind of before the school age. So ages maybe like 1 to 4, maybe what are some of the signs that people see, some of the diagnoses, and then also, what we tell parents and families.
Mm-hmm. I would say like ages 1 to 4 is kind of a hot time for kids to be referred for audiology. A lot of times because we're concerned about speech or behavior. So maybe the child is a little bit behind. So by about age 2, we expect 50 words. And so I would say in the last 6 months, I've seen several toddlers who they're meeting other milestones, but they do not have 50 words. And I personally think it's kind of a post-COVID thing, with just having not been around as many people, and maybe they have siblings at home or whatever. But that's a time when children go in for their well child check at 2 years, and their doctor says, how many words do they have? Are they talking? Maybe mom or dad says how many they have. If it's less than 50, then they usually get referred to just check hearing and make sure there's nothing there that we need to be aware of. Kids also get a lot of ear infections. So before you're 5 years old, your eustachian tube, or that tube between your ear and the back of your nose and throat, it's going to be more horizontal when you're a small child. And then as you grow, it sort of angles a little bit more, and it's easier for that tube to kind of drain on its own. So that's why children get more ear infections than adults. But ear infections can also affect hearing. So we just kind of keep closer tabs on them. Signs that you may see. I mean, sometimes kids are pulling at their ears. Sometimes they're telling you their ears hurt. I have a 2-year-old and a 1-year-old, and it's hard because sometimes they're pulling on their ears and you're thinking that it's an ear infection when really they're teething. And so there can be a lot of different things going on. And it's hard to tell, what exactly is ear pain or ear infection. If you see drainage from your child's ear, if you feel like they're having recurrent illnesses, things like that, that's always time to get checked out by an ENT. If the child has had more than 3 ear infections in 6 months or 4 ear infections in 12 months, they will usually do PE tubes, or pressure equalization tubes. So the tube is being put in the eardrum to keep it open that way, instead of relying on that eustachian tube opening and closing to kind of drain the ear. So if a child had, a child would have had backup if they have a tube in the ear. When they go to sleep, it drains out on the pillow. And so, it's not just backed up inside their head. And so tubes can be something that is really common around this age. Sometimes kids get multiple sets of tubes. As your ear grows, we're putting a hole in your eardrum when we're putting the tube in there, and your body's wanting to fix itself. So it grows, the eardrum, closes up, the tube falls out, and then sometimes we have to put another one in. So ENT is, who's going to be looking at that to see and placing those tubes. But that's also something that's pretty common around those ages, that we're seeing kids for. So other factors too, and this has been a factor with a lot of the toddlers I've seen recently, is they have older siblings. So if you have older siblings that are talking for you, you don't have to talk as much. And so sometimes kids with older siblings will talk a little bit later. Sometimes kids that are learning more than one language at a time will talk a little bit later. And that's an interesting one, because when the pediatrician says, do they have 50 words? We need to group all of their language words together. So if they speak 3 different languages, add up all those words. I've had parents come in thinking that kids are delayed because they don't have 50 English words, but they have, 50 Spanish words or whatever their native language at home is. So I think that's important to note too, that, there are some factors why kids might be talking a little bit later. I think this whole post-COVID generation is going to kind of affect things, because kids didn't have as much community, events to go to and things like that. There wasn't as much social stuff going on when we're keeping kids apart because of COVID and things like that. Also, just wearing the masks. When we're wearing masks, kids weren't able to see our mouths move and read some of that emotion from our faces. So I think that the kids, this post-COVID generation, maybe might see a little bit more of that than previous generations. We've just had a little bit more disruption.
Yeah, great points. So those are some of the signs that kind of we see, maybe parents might see. And then especially fitting, if we had to fit hearing aids on this age, which is like ages 1 to 4, I think one of the biggest things that I would recommend would be considering battery safe doors, right? Because these are kids that are less than 5 years old, like to
Mhm.
maybe fidget with things and open things up because batteries are poisonous if they're swallowed. So I would say that at this age, if we were to fit hearing aids, I would probably make sure that they have some tamper resistant battery doors. Any other things that you can think of?
And then now a lot of them are rechargeable, so we don't
Mhm.
really even have to worry about that anymore, which makes us feel so much better if we're sending home toddlers with hearing aids. Because I mean, as a mom of a toddler, that's the last thing I want to be worrying about. But a lot of the rechargeable now, they're a little bit more resistant to water too. So if they get, dropped in the bath or whatever, they might hold up a little bit better against that.
Mhm.
One thing that I was thinking of is, when we talk to parents and say, oh, yeah, there are some kindergartners that wear hearing aids. It's like, how do you keep that in their ear? So we have this little thing called the Safe Line. And I know Oticon sends it out with all the pediatric aids, but it's a little clip. It looks like a little pacifier clip, but it goes on the back of your shirt. And then you have two little strings that come up and have like a little silicone band around the hearing aid, so that if your child is like going crazy, taking their hearing aids out, throwing them, they're just going to be hanging behind their back instead of, gone. So that's one thing that we use a lot. We recommend a lot. And the other thing that's kind of cool with new tech is find my hearing aids or find my kid. So if your kid has their hearing aids on, you can sync your phone up with their hearing aids so that you can find my hearing aids. And if your child is wearing them, you can also find your kid. But it'll actually GPS locate the hearing aids on a map so that the parents can try to go find them, before the hearing aid dies. And that's definitely come into handy, at the playground or something like that, where it's gotten left behind and parents can go back and look for it. So that was another thing I thought of, just with some of the tech advances for kids. That's been helpful.
Yeah, that's a great idea. And so it kind of takes us into the school age children, right? So now we've kind of talked to you about at birth, maybe ages 1 to 4, and now we're looking at maybe the school ages, maybe grades K through 6 before we hit the teenage thing. So same thing, rechargeable batteries, I would probably recommend as well. Well, let's back up. Some of the signs for ages K through 6. So now they're already in school, and some of the signs might be picked up more by teachers than by parents. And some of the signs could be maybe they're inattentive, maybe in class, maybe they've got poor grades, things like that. And I think that sometimes teachers report that to parents because parents might not necessarily notice that as much. And so, we have these age kids that are coming in anywhere from K through 6, same kind of recommendations that Dr. Galloway had talked about with rechargeable batteries are great. Safe lines might be still an issue at this age as well. Find my hearing aid, find my kid. I love that. So probably you would still use it at this point. Also at this point, because they're more in school than ages, 1 to 4 or 1 to 5, sometimes we have a lot of these kids use we used to use a lot of FM systems, but now we don't. Frequency modulated is what FM stands for. But now, because hearing aids have Bluetooth technology, it's very easy to now just get a little microphone clip that a teacher can wear that the kid can then just take it to classroom, or, have one at the school that the teacher aide knows that this child needs this particular thing to be able to hear the teacher. And what that connect clip, or I would say a remote microphone, does is whoever's wearing it, the sound from what they're speaking goes straight into that microphone that's right here on their lapel. And then it goes straight to the kids' hearing aids. And so it's kind of like direct audio input, where even if there was a lot of noise in the classroom or a lot of hustle and bustle, multiple conversations, that remote microphone will still deliver that really nice signal from the teacher directly to the hearing aids, no matter where the teacher is walking around in the room. Now, that being said, I warn teachers that don't forget to take it off and leave it at your desk. If you are heading out of the room or taking a break or whatever, because it's still connected as long as it's within distance to the child's hearing aids. But a remote microphone is something that comes into play when we're talking about school age children. Some parents, so when we counsel parents, sometimes the parents buy one for the home and they buy one for the school, or the school gets it in the kid's IEP plan, the individual education plan, and then the school will have one there, and then they'll have one at home. So the child doesn't have to cart it back and forth. Again, we're still talking maybe like they're not teenagers yet. This is K through 6. Other recommendations that you might have.
I've also seen a remote might be really helpful for sports, like the coach can use it. So talking about the parents getting one to keep at home. We have a set of siblings that takes it skiing with them. I had not thought about that, but mom was telling me, they're down the hill and I can see them, but they can't hear me. And they're, kids. So this is a way that the parents can communicate with children while they're skiing, because they can just tap directly into their hearing aids. So I thought that was a really cool arrangement. But like soccer or football or anywhere where, you might be wanting to get input from coaches or parents, but the kid is so far away that hearing is going to make that a barrier.
Yeah.
So, and a lot of times kids' hearing aids will come with an accessory. So a lot of times they'll throw in like one accessory for free or something like that. And so maybe that's, one that gets used at home, and then the school district gets one to be used at school. But yeah, the new technology has just done a lot to kind of open up the doors for kids. And then of course, having an app on the phone too. I mean, school age, yes, but then also teenagers, they all have phones in their pockets. And so if we can have an app on that phone, that's going to help them use their hearing aids better or something like that. That's something that we can use to our advantage.
Yeah, I do have to laugh and also throw in a caveat too, because when you talked about sports, I thought, and I was just with a kid, I was thinking, okay, because I'm an audiologist and my kids played sports, there were so many times where I'm like, I'm just going to stick hearing aids in their ears, and I'm going to be sitting on the bleachers, like talking to them in the remote microphone while they're playing sports. And then of course my husband's like, you're not going to be in their ear the whole time, So because I know that I was thinking about it, but I never did it. You might want to check out, if you're a parent and you're looking into that, talk it through with the, for here it's CHASA, but I don't know who you reach out to for coaches being able to have that ability to be able to talk to the child, whether they're on a field or a court or whatever. But then also, I don't know about the advantage or the disadvantage.
Yeah, that's a good point, because I did have a college athlete that brought that up. And so this would be something that, maybe not during games, but maybe just more for practices or something, or to kind of keep that line of communication open. But that is certainly something to be concerned about, is like the competitive advantage thing. And so obviously you'd want to talk that over with kids coaches or, who's ever in charge of the sports program. But that could be a way to communicate a little bit better during practice, or maybe it would be allowed during the games based on the IEP or whatever.
Right.
But I would think, especially in college, that is something that's probably monitored a little bit more closely.
All right. So now we head over to teens. And when we head over to teens, very similar, a lot of things, conversations that we have, but this is kind of what sparked our conversation, because we have a couple of teenagers that have come through. And what we haven't talked about about yet is the fact that teens might also have, or even kids, even as young as school age, when we find out that they might actually present with normal hearing, but they're still struggling in the classroom. And so I was thinking about, I have two different families that I'm working with. And one, the mom was just adamant of saying, no, this is a good kid and a very good studier and good habits, but she's struggling. She's struggling in the classroom. And so we brought her in, had normal hearing. The mom's like, I really think that she's like, every time we're in noise, she struggles. And that's what our office decided to say, okay, wait a minute. She struggles in noise. She's struggling in the classroom. Let's take it a little bit further. So we put her through an auditory processing evaluation and found out that she had this. And so this is something that's totally different. It might not show up on a hearing test, right? On a regular hearing test that you come in for. So it's another extra test, but we definitely did it. And we actually, even though with normal hearing, we fit her with very mild gain or very low gain or amplification hearing aids, and taught her how to use it and everything. We had a follow up with her. And because mom was so bought in that, oh my gosh, the girl that when she came back for her first follow up, she was so chatty. We couldn't get her to stop talking. She was so excited and blah, 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 blah. She's like we're like, oh my gosh, this is a whole nother girl.
Mhm.
And we talked to mom, and mom said, yeah, she's doing amazing now. So thank you. And I said, no, thank you, because you had this gut feeling that
Mhm.
it wasn't just about the hearing test that came out normal, but we had to go a little bit a step further, right, to figure out what was going on and believe what mom said. Now, you have other cases where parents still might not be clued in, and we have to educate parents and the kids. So I have another family where I've got a mom and another kid in the teenage years. Same thing, normal hearing, but struggling big time in school. And this kid already has some other sensory issues and everything like that. So we decided to put him through an auditory processing evaluation. And he also came back with some abnormalities, which we felt that fitting him with hearing aids would also be something that he would like. Now, with this one, we were going to put a live listening experience, which means that we put on some hearing aids for them to just try it on, and he was not having it. He pulled his hood over his head. He yanked them out. He told his mom and our resident that even if I take these home, the minute you put them on, I'm going to take them and throw them. So we're like, okay, how are we going to do this? And so our lovely resident took the child out on a walk around our building while I talked to mom. And I said, look, and I said, I know that you absolutely, and mom is pushing for this, but we're getting some like hesitation from the child, which, I, it's
It
very hard
happens.
to explain. Yes.
Mhm.
So I said, look, this is how hopefully we can ease him in. If you're willing to take the hearing aids, I will explain to you how this works. So I actually put the hearing aids on mom. And then we paired it to her phone. I walked through everything so she could hear everything, hear the changes, hear that it's not even really amplifying very much. And I
Mhm.
talked to her about the circuitry and how it's going to help her child and how to use the app and everything. And I said, look, I said, you don't even have to send these to school with him. Maybe have a conversation about just putting them on first when he's having dinner with you guys, or maybe put him on when you're reading him a book, or maybe just put it on for an hour, let him watch his favorite TV show, whatever it is, And so we had these conversations, and again, these conversations are what prompted this show today, because I thought, if other people have other ways that they explain it to parents, or maybe what we're saying can help somebody else too, then we want to make sure that we get this out there, right? And so I thought, look, just your goal is to get it on him in one particular area where he's not going to be thinking about the hearing aids, and he's happy. So, if it's letting him watch his favorite TV show and it's 30 minutes to an hour, I'm happy with that. And let's try to ease him in. So that was my conversation with him, with her, and she was totally happy with that. And it was, obviously giving options and being flexible to be able to say, in the long run, I see this is what we're going to need for the kid, but I understand where he is. We're going to meet him where he is, and we're going to try to figure out some options for you as a parent to be able to be his best advocate, right? What other options do you have, or ideas?
One thing where I've seen it kind of come up is that teens, start a job. Maybe it's at like a fast food restaurant like McDonald's, or, someplace that's noisy and they need to communicate with other people on the job. Just talking about advocacy, go talk to your boss and let them know you have hearing loss. And if I didn't turn around after you said my name, it's not that I'm ignoring you. I might not have heard you. Maybe get my attention, visually get my attention or something like that. Say my name first before you talk with me, just so that your boss knows that you're not ignoring them. It's kind of like the school of hard knocks, but it's true. I mean, in the rest of your life and as an adult, you're going to have to advocate for yourself and let people know, this is what's going on with me. This is how I help myself, so that people don't think you're being rude or, put off or something like that. So sometimes when kids start jobs, that's when we might be able to tell, okay, maybe there's something going on here, that there's a little bit of hearing loss that we didn't know about, or maybe they do have some auditory processing disorder. That is even something that they may grow out of too. Your auditory processing skills are not fully developed until you're 14. And we know that, every kid is on a different timeline. So maybe by the time they're 16, they're still struggling with it a little bit. It doesn't mean that in 10 years, they're going to be wearing hearing aids. We do not know that. But we use it as a functional measure to help them right now. And then we can kind of reassess in the future. But there's research to show that even, patients with normal hearing. So my dissertation I did on FM systems or frequency modulated systems in school systems. And the research shows that if you take a kindergarten class and you put a microphone on the teacher and then her voice goes above on some speakers in the classroom, everybody listens better. Every single kid listens better. And so for kindergarten and first grade classrooms, the recommendation is that they just have speakers, and we don't use the FMs just for kids with hearing loss. It's for everybody. But translate that to being in high school. I mean, everybody may do a little bit better, be able to pay attention a little bit better. Hearing aids are so automatic. They're really good at reducing noise. I mean, I think that could help anybody. So sometimes people are surprised to hear they don't have hearing loss, but you're putting hearing aids on them. So I like to phrase it as we're using these hearing aids to help simplify their auditory environment so that they can just succeed a little bit more. If we can reduce some of that background noise for them, their brain is doing less work to try to get rid of that. So I just wanted to throw that in there too, because I think sometimes people think, oh, they start wearing hearing aids when they're, 6 and then they wear them for the rest of their life. If it's for auditory processing disorder, not necessarily. So that's something that we can keep checking, and we can look back to the normative data to say, okay, how are they doing with, against their peers? And it may be something that they age out of or they learn to compensate for. And, we don't need to do anything with it further, but we're just trying to help them right now, and make them successful in school and kind of meet them where they're at. So,
yeah. Awesome. All right. Well, so that's kind of all we have. But again, as a collaborative space, if you have anything to add, please comment. Please add to this show, share it out if you need to. I'm going to see if I can point up there, but you see that like code right up there above our heads. So if you have questions down the line, you can actually scan that code, and it's all of our contact information. So you can reach out and you can let us know if you have an idea for the show. You can reach out and say, hey, I had a question about what you guys talked about. Or if it's like, hey, I don't live where you are, can you help us find an audiologist in my area that sees kids? And we can do our best to reach out to people that we know or look at some of the directories that we have access to be able to help you find who you need to see, whether you've got a child with a hearing loss or a family member, or you're a teacher as well and want to reach out to audiologists in your area to partner with them and to have a collaborative space. So scan that QR code if you want to and reach out to us. And we will try to be back next Thursday. Oh, no. Next Thursday is Thanksgiving. So
we won't be here.
We won't be here, but we'll be back the following Thursday with another episode of All Things Odd. So thank you guys for tuning in, and hopefully this was helpful for you.
Thank you.
All right. We'll see you.
Bye.